let's talk about alcohol withdrawal. Now, technically, the withdrawal portion of this is a medical condition, not mental health. But alcohol use disorder is a mental health condition that can cause some pretty serious medical issues. So we're going to kind of touch on all of it here. So what is alcohol withdrawal? It is a set of symptoms that results after someone attempts to quit or abruptly stops consuming alcohol after regular long-term consumption. So with alcohol use disorder, someone drinks compulsively. They can't control how much they drink, so they have no control. And they tend to be super anxious or irritable when they aren't drinking. So when you consume that much alcohol for a long period of time, your brain starts to get used to it and it changes some of your brain chemistry. So when someone stops drinking, their brains can go haywire. Now, keep in mind, this might not be someone who is trying to quit. It might be someone who was in an MVC and now they're hospitalized and they can't drink like they normally would. Okay, so make sure you're keeping that in mind. So we always want to ask the question and be very specific. How much do you drink on a daily basis? And when was your last drink? This helps us to start establishing a timeline to be able to predict when their symptoms are going to progress. Symptoms of withdrawal can occur as early as 6 hours after the last drink. They'll usually involve things like tremor, anxiety, nausea, vomiting, and insomnia. This feeling is what usually drives them to another drink. Okay, this is usually what keeps them drinking because they don't like feeling this way. And this makes it really hard to quit. Now, these symptoms are going to peak at about 48 to 72 hours and will get worse and worse before they start to get better, including severe versions of all these initial symptoms, plus hypertension, diaphoresis, hallucinations, and even seizures. Left untreated, these things can progress to withdrawal delirium or delirium tremens, also known as DTs. Now, DTs are a medical emergency. It usually comes on about 3 to 10 days after the last drink. They'll have all of those previous symptoms we talked about, but at severe levels. So severe tremors, severe diaphoresis, nausea, hypertension, etc. Plus global confusion and disorientation. This is the hallmark sign of withdrawal delirium. They can also have agitation, a high fever, autonomic instability, and seizures. This condition can and will kill someone if left untreated. So even if you have a client come in for something completely unrelated, like a car accident, it's so important to ask them if they drink regularly and when their last drink was. That way we can get them some treatments early and monitor them closely to prevent it from getting to this point. So when we are assessing a client who's at risk for alcohol withdrawal, there's usually some sort of protocol to follow. We've attached a couple of examples to the lesson under references. One of them is the MINDS score, and the other one is the CWA score. So either one of those can be used. Now, our primary intervention is always going to be anything having to do with safety. So that might include airway protection. That might include seizure precautions, or possibly even a sitter or restraints, depending on, how agitated they are. And then we're going to assess their symptoms, and we're going to give them a score based on whichever protocol that you're using. Most protocols will then have a guideline that tells you how to intervene based on that score. So for example, at one facility I've worked at, we would assess the CWA score every 2 hours. And if their score was greater than 25, we would give 1 milligram of lorazepam. And then we would reassess in 1 hour. Okay, so that was our protocol. Again, you really just need to know your facility's protocols and make sure that you're following them. So again, we want to assess frequently. We're going to initiate seizure and fall precautions. We're going to reorient them as needed. Again, maintain safety at all times. Perform a self-harm assessment. With alcohol use disorder, clients may be so dependent on the alcohol for their coping strategies that it can be very difficult to not have that. And then we definitely want to encourage them to seek some sort of long-term therapy or support. And this includes things like Alcoholics Anonymous meetings, expressing their feelings and bouncing ideas off each other can be very therapeutic. Now, as far as medications for alcohol withdrawal, we use benzodiazepines almost every time. I think I already mentioned that lorazepam is the most common one that we use. We'll also use antiemetics for the nausea, and we'll give vitamin replacements. Those who overuse alcohol tend to be quite deficient in thiamine and B12 and other micronutrients. So we'll give them something called a banana bag, or some people will call it a rally pack. It's called a banana bag because it's yellow, literally, because of the thiamine. So it's full of things like thiamine, electrolytes, B12 that can help to prevent encephalopathy. If you go back to the neuro course, there's a great lesson on encephalopathies, so you can learn more about why that happens. Now, another medication that we can give for someone who is trying to quit drinking is called disulfiram, or Antabuse is the trade name for that. Essentially, if they take this medication and then get even one sip of alcohol, they are violently ill, like really uncomfortable. So this includes things like over-the-counter meds or mouthwash, okay? Anything with alcohol in it. So make sure that you educate your patient that they shouldn't start the Antabuse until they haven't had alcohol for at least 12 hours. And then the effects of the Antabuse can last for days. So absolutely no alcohol, or they're just going to feel rotten. So priority nursing concepts for patient with alcohol withdrawal are, of course, safety, nutrition because of the lack of electrolytes and vitamins, and coping because we know this is an emotional coping mechanism. Okay, so let's recap. Alcohol withdrawal occurs after someone who uses alcohol chronically or excessively for an extended period of time stops abruptly or attempts to quit. Make sure you're assessing the timeline because symptoms can start as soon as 6 hours after the last drink. They'll peak at about 48 to 72. And then we just need to monitor them closely and assess them frequently to prevent withdrawal delirium or delirium tremens. It's a medical emergency and it can be deadly. So we give benzodiazepines and vitamins to manage the symptoms to get them through this dangerous period of withdrawal. And then we always prioritize safety, including, fall or seizure precautions. And again, if they have severe agitation, they may even require a sitter or even restraints. So make sure you're following your facility's protocol for those. All right, so that's it for alcohol withdrawal. Make sure you check out the resources attached to this lesson to learn more. Now go out and be your best self today. And as always, happy nursing.